Together, we now have a once-in-a-generation opportunity to prove to each other that we can be greater than the sum of our parts. The magnitude of this pandemic, which has touched virtually everyone in the world, clearly deserves a commensurate evaluation, an honest evaluation. This is not a standard report that ticks a box and is then put on a shelf to gather dust. This is something we take seriously. We learn honestly, and we follow through too. Honest to the assessment, and honest to the follow-through and implementation. That's what's required. With this in mind, I'm proud to announce that former Prime Minister Helen Clark and former President Ellen Johnson Sirleaf, and also a Nobel laureate, have agreed to serve as co-chairs of the evaluation committee, which we're calling the Independent Panel for Pandemic Preparedness and Response, IPPR. Prime Minister Clark of New Zealand went on to lead the United Nations Development Programme, as you know. And President Sirleaf of Liberia, as I said earlier, is a recipient of the Nobel Peace Prize. Of course, we will be hearing from them shortly. But I was so proud that these two distinguished ladies have accepted the challenge and agreed to lead the panel. Prime Minister Clark and President Sirleaf were selected through a process of broad informal consultation with member states and world experts. I cannot imagine two more strong-minded, independent leaders to help guide us through this critical learning process, to help us understand what happened, an honest assessment, and to help us understand also what we should do to prevent such a tragedy in the future. So collectively, as a world, to say never again to such kind of tragedy. This once-in-a-century pandemic has hammered home a critical lesson. When it comes to health, our destinies are intertwined. The virus has upended health systems in some of the world's wealthiest nations, while some countries that have mounted a successful response have been of modest means. We know that when countries take a comprehensive approach based on fundamental public health measures, such as find, isolate, test, and treat cases and trace and quarantine contacts, the outbreak can be brought under control. But in most of the world, the virus is not under control. It's getting worse. More than 11.8 million cases of COVID-19 have now been reported to WHO. More than 544,000 lives have been lost. And the pandemic is still accelerating. The total number of cases has doubled in the last 6 weeks.